Hi everybody, I am Dr. Kavya D. Sharma. I am a consultant gynecologist and a senior IVF specialist working in Baby Science IVF Clinics, Kormangla branch. Today I will be discussing about what is infertility and how to evaluate the female infertility in particular. So coming to what infertility means, according to the WHO, the infertility means inability to conceive even after 1 year of unprotected intercourse by the couple. Normally, 80 to 85% of the couples they conceive within 1 year itself, whereas 15% of the couple cannot conceive naturally even with an unprotected regular sexual intercourse. And these patients are called infertile patients. When the infertility patient comes to you, the first basic thing is to evaluate both the couple, and I will be discussing how to evaluate in particular to the female partner. So the first thing what we do is we take a proper history and the examination of the patient is done. Then we will do the routine blood tests. Routine blood tests such as complete hemogram where hemoglobin of the patient is checked. Then the sugars, that is the random blood sugar and a HbA1c is checked. The thyroid profile is done, the serum prolactin is done, and the serological tests are done. These are the routine blood tests which are recommended. Then we will do the transvaginal ultrasound or the pelvic ultrasound. This is done, it's a very simple ultrasound which is done transvaginally, and initially it is in the transvaginal ultrasound we basically assess the uterus, the ovaries. In the uterus, coming to the uterus, we will assess what is the shape of the uterus, the size of the uterus, and if there is any abnormal masses present in the uterine cavity or in the musculature, such as fibroids, adenomyosis, polyps. These things are diagnosed. And then when we are assessing the endometrial lining or the inner lining of the uterus, we will assess any other pathologies are present in the endometrium as well. Next thing is we assess both the ovaries. In the ovaries mainly we will see what is the size of the ovary, the volume of the ovary, and in case any cysts are present we will measure that cyst and we will be able to diagnose it. Next thing in the scan, in the ovaries we will see for the antral follicle count. These are nothing but the small follicles which are seen on the second day of the periods, and the number of these follicles will determine the ovarian reserve. Next thing to assess the ovarian reserve is the serum AMH test. It is nothing but a blood test which can be done any day of the periods, and this test, the normal range varies between 2 to 6. More than 6 indicates PCOS and less than 1 usually indicates a low reserve. These are the routine common blood investigations which we have to do and which is mandatory. Next thing is, depending upon the patient profile, we will suggest some other hormonal test on second day or third day of the periods, such as serum FSH, LH and E2, estradiol, serum estradiol and serum progesterone. After these blood tests, the other tests which are recommended are the tube test. So next thing is the tube test what we do. In that the most commonly done is the HSG test, that is also called as the hysterosalpingogram. This is nothing but a dye is passed through the cervix and an X-ray is taken in order to see if the tubes are open or not. Okay, after doing this test we will get to know if the tubes are open or not, or if the tubes are blocked or not, and even if there is a blockage, at which level there is a blockage, we will get to know through this test, that is the HSG test. Next invasive procedures which we recommend in order to evaluate the female infertility will be laparoscopy, hysteroscopy and MRI. These are advanced tests which are not routinely done, but if we are suspecting any pathology in the routine tests and it requires intervention, then only we will suggest these tests. Thank you.